county, not city.
Did you get the wrong one? The one for today?
Oh, you know what?
You gotta watch it.
Thank you.
Welcome back.
Hello.
We missed you guys. We were here last Friday. You guys skipped class.
Yeah. We decided to have a sandwich day.
There you go.
Scary.
Well, Dr. Zaratis and I were, from Wednesday to Sunday, we were taking a course on our CEREC machine, which some of you guys have seen us use. A lot of new technology out there. And there's actually some courses going to be here in Tucson. I want to say it's in the first part of next, so in a few weeks, 2-3 weeks. And Travis, who's our Patterson Dental Supply, said if any of your students want to come and like walk the floor and at the exhibition floor, see some of the new materials that are out, you guys are welcome to do that. Just let me know and I can let him know. It's there on a Thursday. I think it's Thursday and Friday. So I mean, if it's something like that and we wanted to go as a class or something, then we would somehow need to catch up that class if we wanted to, either on Saturday or whatever. That's up to you. But I'll talk to him and get the dates a little bit better, and maybe something. I know there's the Patterson Expo up in Phoenix, which is it's a state expo, and I can get the date for that because you guys could probably go to that as well. I'll just let them know. It's really neat to see all these new technologies. I mean, nowadays, and hopefully we'll integrate that into our practice, because the new way to take X-rays is changing. So even now you're learning the digital, where it's either in the way we do it or with the new sensors that we don't have, but some offices may. That's a cable connected directly to the computer. Now it's changing to what's called a cone beam, which is kind of like a CT scan of your head, basically. And you just sit the patient kind of like on the Panorex here, sit them down or stand them up and take it. And you can make slices through teeth. You will have to, I think the bad thing is that you still will have to take a PA, because if you're doing a root canal or something like that, obviously you can't go and take a new cone beam of that tooth. But so you'll still need to take a PA or something, but like a full mouth series probably is going to get less and less common in the next 5 years or so, because a lot of people, as that machine becomes more affordable to practices, I think it's going to come in, because the technology is amazing. Plus it integrates with this technology. You use that and you integrate it with this, and they talk to each other, and you can like pre-do your surgery. If you're doing implants, you can pre-design it and do it digitally first. Make some stents and some appliances that you put in the patient's mouth, and pretty much have done the surgery on the computer, and then you bring the patient back and you just walk through it, and it's so precise that it's amazing. It's incredible. But so that's what we were doing up in Las Vegas. So, but it was a lot of fun. Anyway, so let's talk a little bit about removable prosthodontics, or removable partial dentures, or removable dentures. So anything that's removable obviously is removable. It's prosthodontics obviously is something that's not yours, that either a knee or a shoulder or something that you're getting surgically implanted, or in this case just something that's replacing a missing tooth or a missing teeth or something. Okay, so it's something that's not cemented, so it's removable. So the goal of removable prosthodontics appliance is to replace areas of missing dentition and to restore a patient's bite. Obviously the patient needs something because one, for aesthetics, especially if it's a front tooth. Nobody wants to go without a front tooth. You know, you can take out all my back teeth, but don't do anything with my front teeth. And we'll get patients to do that. Oh, it's a back tooth, take it out. It's a back tooth, take it out. You know, and you try to educate them that, you know, just because it's a back tooth, you take it out, it's going to cause changes in your bite long term. So we try not to just take it out because it's kind of a domino effect later on. But obviously we're trying to restore the patient's bite because they want to somehow eat. And when you say somehow eat, you won't ever eat like if it's your natural teeth. You know, prosthesis, it's a prosthetic and it will never be your natural teeth. Implants are the closest to your natural teeth. But anything that's removable is, you know, just a substitute for having no teeth. It's not you're replacing your teeth, it's just an alternative to having nothing at all. So what are they? A removable appliance that replaces missing teeth and soft tissue, not just teeth, while preserving teeth and other oral structures. And by that I mean, by preserving other teeth is that if you're doing a removable, means that you're not cutting down a natural tooth to put a fixed bridge. Because for a bridge to do a crown, if you guys have seen us here, we have to cut down sometimes a virgin tooth to put a bridge or to put something else on. Okay, so by doing a removable, sometimes you modify it a little bit, but you don't cut it down all the way. Okay, so you just use it as a support to retain the partial denture, but it's not, you know, you're not sacrificing that tooth to put a fixed or not removable denture. So that's why preserving teeth is there. So what are the components? And these are things that you'll need to know. Okay, I'll give you the definition of these, and you'll match them. Okay, and a partial denture or a removable partial denture could be this. Could be any of these. Okay, so I'll pass these around. All of these are removable partial dentures. Okay, to replace multiple teeth or to replace one tooth. I just did one like this, which is a flexible, to replace one tooth on the bottom. The patient, eventually she wants to get an implant. She can't afford it right now, has a couple kids going through orthodontics and braces, and so she can't afford it. So she wanted, I just need something there so I don't get food stuck. So I showed her one of that. I said, we can make this just to replace one tooth. Either acrylic, or there's one that's a little, we call them little spiders, and it looks like a little spider.
Do those weaken the other teeth though?
Yes, long term, especially if you have those that have a tooth in front and behind. If they're anchored to a tooth in front and behind, probably not. But sometimes they're only anchored to a tooth in the front, and then you can imagine every time you're biting down, you're doing this to the tooth. So long term, it does cause problems. You just need to be aware, get in there, and after you eat, take it out, rinse it out, brush, and then put it back in. You don't want to leave food and stuff stuck underneath there because you could get, you know, a cavity underneath the wires or the attachments. So
Do they have to use some sort of like cement, put it in there every day, or no?
These, the removable that have those clasps, usually not. On a full denture, sometimes yes. If it's like that plastic one that is just resting on the gum tissue in the back, sometimes they'll move, and we will tell them to put just a little bit just in the back so it sticks. Yeah. So it doesn't move. It just makes it a little bit more comfortable. But if you can go without those things, it's better. But sometimes we can't. So abutment, I think we've talked about abutment before. It's the anchor to either a bridge or a removable. It's an existing tooth or implant used to support an attached framework of the RPD. And the framework is that, what you have there, that metal. Okay, we'll talk about the framework. So the framework is just the main structure that supports the teeth. Okay, so the abutment are this tooth right here, that tooth right there, this tooth right here, and this tooth right here. Okay, because that's what's supporting that partial denture. Okay, the metal is called the framework. This is the abutment tooth, abutment tooth, abutment tooth, and abutment tooth. Okay, everybody clear on an abutment. And this is for a removable, but you also use the same word, abutment, for a bridge. If you were bridging from here to here, and we'll talk about it next lecture, this is the abutment and the abutment for a fixed bridge. Okay. So the framework, again, just like I showed, is the metal. Okay. It can be metal or acrylic, like that other one, the main framework, not the teeth. Could be metal or acrylic, and it just provides the strength for the removable partial denture, and it supports, you know, or it gives a base for the teeth. It has the connector. We'll talk about that, the retainers, and the rest, and we'll talk about that. Okay, so the framework is just, you know, the metal, the main structure. Okay, you have a connector, and all these you need to know. Okay, so I didn't put stars on these.
The framework?
Yeah, all of them. So I think I just put it on the first one.
Where it says A.
Yeah, but all this 1 through 7, or I don't know how many there are, 1 through 8. All these you need to know the definitions. Okay, so framework. The connector is a metal or acrylic bar which connects the right side of the appliance to the left side. So basically connects the left to the right. Kind of common sense. Connector connects left to the right. So this would be the connector here, and this would be a connector here. Okay, you're connecting the left or the right. Or you can have a lingual bar. Okay, that's a connector. Okay, you can have kind of funky looking teeth connectors. I mean, whatever is going to work best for that patient, depending on the number of missing teeth and what the lab is trying to do. You've got to have some stability. Sometimes you're only missing this side, but you can't just do, you know, a partial here if you don't have anything in the back. So somehow they've got to anchor over here. So you'll have, you know, sometimes a bar across here just to anchor on this side, and then that distal extension there just on one side. So, you know, the lab can get, and ideally the doctor designs this, but when you've worked with a lab for so long, you know, they kind of know what you like, and, you know, we'll just say, please fabricate, you know, cast framework for maxillary partial, and you'll tell them where the rests are, and I'll show you the rest right now, and then they design whatever would fit the best and have the most retention. So again, the connector could be this, you know, just right here, connects the left to the right. Okay, so the connector. So you've got the framework, you've got the connector, you've got the abutments. Okay, clasps and retainers. If you look at those that I passed, hey, how are you? If you've got clasps and retainers, if those that I passed, there are the little prongs that come out, and they can either be metal or they can be plastic. Okay, and that's just what's going around the abutment tooth to help that partial stay in. Okay, so here's a framework, and here's a C-clasp. Okay, here's an I-bar, we call it, or a T-bar. Sorry, the I-bar wouldn't have these. It would just be like a single little. This would be a T-bar coming up. Again, and the lab will design whatever they think will work the best. And these retentive arms have to be underneath, kind of like the fattest portion of the tooth, so that when it slides in, it kind of locks underneath the little hump. Because if you're up above, it's going to slide on and off. So you want it to, it'll expand, and then as soon as it goes beyond the little fat part, it'll like tighten up. And that's what gives it retention. Okay, so it could be acrylic or metal. Okay, so all those are the clasps. And why would they do an acrylic one here in the front?
Aesthetic reason.
Yeah, so the patient doesn't want to show a metal clasp, and sometimes they're not as strong, but you know, it's tooth color and it's hidden a little bit better. So these you want to do something like this. Obviously they charge a little bit more. You have to tell the patient, and you have to instruct the lab that that's what you want. Because if you don't, you're just going to get metal clasps. If you want a resin or an acrylic clasp, please, put acrylic retention on tooth number such and such. Please use cast retention on tooth such and such, and you've got to communicate with the lab what you need. Okay, artificial teeth. Well, kind of self-explanatory.
Did we skip saddle and base?
Did I do?
Mhm.
Maybe did. I'll see if it may be reversed.
Maybe,
If
yeah,
not,
maybe.
it may be reversed. The saddle is basically, I'll see if I've got a better picture, but pretend that the teeth are the cowboy. The saddle is just what's up above the ridge. Just, okay, so it's the saddle. The saddle is just up here without the teeth. Okay, so and it may be out of order. What's the saddle?
It was
is what?
number 5.
I think I kind of skipped it. Sorry.
It's okay.
Anyway, the saddle is the top. Okay, so think of the teeth as a cowboy. The saddle is what's up above, up on the ridge. What does it say on the saddle? Acrylic portion of appliance that rests on the alveolar ridge, so the bone ridge, attached to RPD and holds the artificial teeth. Okay, so it's just the top of the acrylic.
Perfect.
Okay, so artificial teeth are made either of acrylic or they could be porcelain. It depends on what the patient wants. The porcelain they used to be a lot more aesthetic. They used to look a lot more natural, but now even the plastic teeth are, they make them look, I've got a few denture teeth here that you can pass around. They just come in rows like that. You select the size, the shade, and the anatomy that you want. They just come like this and embedded in wax, and the lab just starts taking what they need and they put them in the acrylic. Okay, so those are the denture teeth, artificial teeth. The rest, again, kind of common sense, is what actually rests on the abutment. So this little extension right here is the rest. Okay, and what does the rest do? If you didn't have this rest and the patient bit down, this would slide down. Every time you bite, it would move down and impinge on the gum tissue. Okay, like that acrylic partial that I sent around, it doesn't have any rests. It's just got clasps. So every time you bite down, it's going to go up and down and cause a little bit of pressure on the gum tissue. Over time, you get used to it, but it's not as comfortable as if it's resting on the tooth. Because when you bite down on this is supporting, supported by two strong teeth. So you're not going to have that up and down movement of the partial, so it's a lot more stable and more comfortable for the patient. Okay, once they get used to having all that plastic and metal in their mouth. But can you see why it would be more comfortable? Because it's not. You can put more biting force because you're not biting down and kind of crushing your gum every time you bite. Okay, so this is the rest, and you can see them on those partials there. It's just that little finger like that rests on the tooth. The phalange is what, if you have the saddle up on top and the teeth, the phalange is what comes down the sides on the buccal and the lingual of the alveolar ridge. Okay, so it's kind of like the saddle bags. If you have the cowboy, the saddle, the cowboy, and then the phalange, which is the saddle bag. Okay, so it covers the whole alveolar ridge, not just the crest. Okay, so this is the phalange. So you have the saddle, and you have the teeth, and then you have the phalange on the buccal and on the lingual here. So it's the extension, kind of what's replacing the gum tissue there. Okay, question? Okay, so this is the buccal phalange here. Again, this would be the base or the connector, the clasp. I think that's a clasp. When we're doing implants, sometimes we'll in order for the patient to have a tooth, we'll make a flipper. So this is called, we call it a flipper because you can flip it on and off. Okay, and the surgeon will ask for no phalange. Okay, so this whole thing will be cut off, and sometimes part of the tooth, because they don't want any pressure on that surgery site to allow the bone to grow. So they'll ask, you'll write on the lab slip, please fabricate maxillary flipper, tooth number 8, shade, whatever, no buccal phalange. Okay, so they won't put this on, they'll cut it off so that it's not resting on that tooth or on that implant. I don't know why I put this in. I'm guessing this is for the rests. So here's a rest, rest, rest. Okay, everybody clear on all of those? The clasp, metal or acrylic. The teeth, artificial teeth, can be porcelain or acrylic. The saddle or base, and then the phalange on the buccal. What's this called? Connector, good. What's all the metal called? Framework, good. And what's this tooth called? Good. That?
The rest.
Good. This guy?
Connector.
Good. And these guys? This guy?
Oh, the class.
Clasp. Good. Let's see what else was there. I think that's all of them. Okay, so know how to put those definitions together. Okay, advantages. Star, TP. Okay, so what are the advantages of partial denture? One, improved oral hygiene, because you can remove it. Okay, and you can argue that, improved oral hygiene, because if you don't remove it, then you leave a whole bunch, and we see it all the time. Patients will come in and they've got their denture or their partial, and you wonder how they have it in their mouth. There's so much stuff and crud underneath those things. But all you can do is tell them how to keep them clean or try to keep them clean. So I would argue this, and I would think that a fixed would be more hygienic. Even though it's a little bit, you can't remove it to clean it, you just have to take a little bit more time to get underneath it. But anyway, if you do use it the way you're supposed to, and after you eat, take it out, rinse it, and put it on, it could be improved in hygiene. You can replace a long span dentition, okay? Like that acrylic one that I have there. You're missing all the back teeth. Okay, so you can add 4 or 5 teeth from your canine all the way back, all in one prosthesis. Okay. So instead of when you have the longer the span bridge, you can do a bridge. You can do a bridge, three teeth, and you're okay. Sometimes 4 teeth with 2 abutments and replacing 2 teeth. Maybe you go from the canine, 2 premolars and a molar. That would be strong enough. You start to go 5 teeth, 6 teeth. It gets too long, and that bridge, you're putting too much weight on 2 smaller teeth. You got 2 teeth replacing, holding on to 4 missing teeth. Over time, what's going to happen? All the stress of that, you're going to have those teeth fail on you, break. Okay, cause problems. The other thing is that you've got 2 teeth. Anything goes wrong with that bridge, and you've got 6 teeth connecting. You break the porcelain, or 1 tooth goes bad, then you've got $8,000 that you've got to redo. Okay, so everything's connected. You got to take the whole thing and redo because one thing went wrong. Okay, so again, here you can do 4 or 5 teeth with just one appliance. So you can replace a long span dentition. It can be used to support periodontally involved teeth. So if you have teeth in the front that are a little bit loose, that you can design that framework to somehow support those kind of wobbly teeth. Okay, you don't want to use your framework to put stress on a tooth, but sometimes we'll put as the connector behind those loose front teeth, we'll put what's called a lingual apron, and it's just like a flat framework around the back side of those front teeth, just supporting them, okay, so that they're not, you know, floppy. You don't want to put any pressure on them, but you can somehow support teeth that have some gum issues. Okay, so make sure you know those three. Okay, removable partial denture preparation appointments. Okay, these you'll have to, I think you have to put them in order. You may have, yeah, I think you just have to put them in order. I think there's four or five, and you know, just know what's first, second, third, or fourth. And we'll go over the or a little bit later on today in the lab. So the first appointment is a treatment plan, like with any treatment plan. If it's a new patient coming in, we've got to have the patient in, take x-rays, get all the diagnostic information, and treatment plan that patient. Okay, at this appointment, again, we do anything that's needed to come up with intended treatment for this patient and make sure they agree. If they agree, then their next appointment, oops, I guess here we took diagnostic impression. So you're just going to take your alginate impression to get your first model. Okay, so just an alginate impression. They've got, you know, a couple canines here, nothing else. You snap that, then again, the alginate gives us what? Just a basic model. You know, we're not really worried about, you know, much detail. We've got bubbles here, but all we need is a model for the lab so we can start the case once the patient agrees. Here's your lab slip, and we'll go over it a little bit later. Please fabricate a custom tray. So you take your impression, you fabricate a custom tray to take a little bit more precise impression. This is what we'll get back from the lab, your model with a custom tray. Okay, you can see you've got your abutment teeth underneath here, and then your missing teeth, so you'll be able to get a more precise impression using this. Next appointment. Okay, you'll get the model, you'll design your case. Your next appointment, you're going to modify, you're going to put your rests where you need the rests on the abutments. You're going to modify any teeth that are tipped or angled. You're going to, you know, kind of parallel the wall so it goes in and out. Remove any areas that you don't need. Take the shade of the teeth that you have so that you can write on the lab slip what we're going to need. And then we're going to take your final impression. Okay, you're going to use that custom tray to take your final impression. Okay, so now after you have your rests and you've modified your teeth, you're going to write, please fabricate your framework on the lower RPD, and we'll talk about base plates right now. Okay, so you'll get this back from the lab. Okay, you've got your impression, you've got your models, and you designed the case. This is what's called a base plate. Okay, this wax. Basically what we use is, if we don't have enough teeth to get a good bite, then we use that wax so that the patient can bite into that wax so we can register the bite and the lab can continue working. Okay, so it's more to register and to shape the lip. This patient has, you know, quite a few teeth, but here in the front they're missing all their incisors. Okay, this is the wax plate or wax base. Okay, and again, we don't have any teeth in the back, so we're going to use that to register the bite so that the lab can mount the models. Okay, so once that case comes back, we're going to get your framework. We're going to get this framework back. If they are only missing a few teeth, you can, on your lab slip, you can tell them to put the teeth in. If they're missing too many teeth, then we're gonna have that base plate and we're gonna register that bite. So this third appointment sometimes is we try the framework, and it's also a wax try-in because it'll have the teeth on it already. Okay, but if they're missing too many teeth, it's just going to be a framework try-in. But if it's just, you know, they have a tooth missing here and a tooth missing here, and we're not really concerned about, you know, the bite because we've got enough of the natural teeth, then we'll just set the teeth in there. Okay, so at this appointment, the framework is tried into the patient's mouth. The artificial teeth will be set on the framework in wax. This will give the dentist the opportunity to make any adjustments of the location of the teeth and the opportunity for the patient to give feedback on what they like and don't like. While the teeth are still in wax, I can still move them. I can still change them if they don't like the shape. I can still say, if they say they're too dark or they're too light, I can tell them, send it back to the lab and say, replace these teeth. Okay, so this is an important, if we're doing the wax trying with the teeth, it's important that the patient like them before you proceed. Again, if long span teeth are missing, then we'll add, instead of doing a wax try-in, we'll ask for the base plate so that we can register the bite. So here it is when we would try it in the patient's mouth. You can see in the back here how we register the bite. You get an indentation, and then the lab can mount that case. You can also put some bite registration material in the patient's mouth to get a more accurate bite if you need to. You take a tooth shade and you tell the lab, please fabricate a wax try-in with the teeth, shade A3, onto the lower partial. So again, we're just communicating with the lab. Now here's the lab. They've got the models, they've got the wax bite, so they're putting this together and they're going to put them on a hinge so they can open and close it just like the patient would, and set the teeth. So there you have the teeth set in wax. So that's what you're going to get back so you can try it into the patient's mouth. So once the patient comes back, the last appointment, and the patient likes it, it says, please process and finish and return for delivery. Once you say process, does the patient agree? Then there's no turning back. Okay, patient needs to understand that if something's wrong, that, you know, if they agreed to it and they don't like the shape or the color or how the tooth is longer or shorter, then you can't do anything about it. You can send it back to the lab, but the lab's going to charge you to take that tooth out and put a new tooth or reshape them or do whatever. So the patient needs to know there's going to be an added charge if we process it. Okay, so you're going to get it back, and the last appointment is a delivery appointment and adjustment. At this appointment, the finished removable is delivered. Any necessary adjustments are made. The dental assistant will review the care instructions and recommendations to the patient. Okay, and usually, you tell the patient what would be some things that you tell them. Make sure you take them off at night. We don't recommend them wearing. Some patients will sleep with them, but they're not supposed to, because you're supposed to allow your gum tissues to rest. Make sure you brush them with a toothbrush, no toothpaste, because toothpastes are abrasive. You want to use just soap, like liquid soap, and brush them. And they can use some of the denture cleaning solutions that they can get over the counter. Sometimes we tell them they can put them in like white wine vinegar, because that cleans them a little bit. Every now and then I'll tell them to put maybe a teaspoon of bleach in a cup of water just to disinfect them if I see that they're like really stingy. Tell them to do that. Then you have to tell them that may kind of lighten the color a little bit with the bleach. After the delivery appointment, normally we'll see them in a week or two, unless they call and say that they're not having any problems. Okay, so here's the sequence. Okay, so examination, treatment plan, and you take your preliminary impression with your alginate. Second appointment, you prepare your rests and your guide planes for your teeth. Third appointment, you get the framework, and again, it's going to be bite registration. If you have a long span of teeth that you're replacing, you're just going to register the bite. If it's just a few teeth, it may be a wax tooth try-in. Okay, so that third appointment can be either or, just a framework try-in or a wax tooth try-in. And the last is a delivery and adjustment.
Yeah, we don't have that in our.
I think I just wrote that in. You do have them, but I think I just summarized what we talked about.
Okay, yeah.
So that may not be there,
Yeah.
if you want to take a picture of that. But you do have them because it's, yeah, so it's 1, 2, 3, 4.
Oh, it's the.
Yeah, so it's C. It's letter C there where they're all, but I think I just made this slide to make sure you guys took note of these.
So the summary, the shorter version.
Okay, everybody got it? I think I did it because this number 3 is a little bit confusing. Okay, on the test, some students were messing up because it says framework try-in or framework and wax try-in, and they weren't sure if it was the same one, but it is the same one. It is the same appointment. Got it? All right, everybody good?
Yeah.
Okay, so removable, now this is a full denture. Those were the appointments for a partial denture. So what's the difference between a partial denture and a full denture?
It's replacing all of you.
Yeah. So partial denture means we're using some of your natural teeth as abutments. We're not replacing all of your teeth. Okay, so the components of a complete or a full denture. Okay, so like for a partial denture, we had the framework, we had the clasp, we had the rests, we had the phalange, all those, okay? So for a full denture, we've got a base, and this is the portion of the denture that contacts the alveolar ridges and the underlying tissue. The base is made up of acrylic. Again, the phalange is the same thing, the portion of the denture base that extends from the alveolar ridge to the buccal facial borders of the prosthesis. So the phalange is the same thing, except it's going all the way around, not just where there's missing teeth. And again, artificial teeth, same thing, made of acrylic or porcelain. So that's kind of what a denture would look like. You've got the base. The base is, you know, all this here that rests on the alveolar ridge or the tissue. Anywhere there's it's in contact with your tissue, hard palate or the ridge here, that would be the base. The phalange is what extends from the alveolar ridge up. And then you've got the artificial teeth. Okay, so really only those are the base, the artificial teeth, the phalange. Okay, so how do we make these guys? Same thing, first appointment, examination, and treatment plan. Primary impression, again with alginate. Again, you don't need too much detail, you just need a model to get started so that we can make a custom tray. Okay, so please fabricate custom tray, that's what's going to go on your labs list. Okay, this is what we're going to get back, a model and a custom tray. Once we get the custom tray, then we're going to take our secondary or final impression, okay, just to get more accuracy on that impression. Using the custom tray, a final impression is taken and poured up into dense stone. These casts are sent to the lab for fabrication of base plates and wax rim. So the base plate is just kind of like the preliminary denture. It's not exact, but it just gives us a base plate. And the wax rim is basically for what? What's it doing? Right. You're going to shape the wax rim to shape the lips, give the lip support, get the height that you need. You're going to mark your midline. Again, we're working with no teeth, so we're trying to get something relayed to the lab, more or less, you know, and we'll send the picture with the patient in there, more or less, because sometimes the midline will be off, and you want to give the lab as much information. You'll set the lip line, their smile line, so you know how much teeth is going to be showing. So we'll try to give all that information to the lab, and also we'll use those base plates to set how open the patient will be. Okay, base plates are fabricated on the cast model that was made, either out of acrylic. This device serves as a temporary and represents the base of the denture. But when you put it in, when you use that base plate, most of the patients will say, "This isn't how my denture is going to fit, right?" You usually have to explain, no, this is just a temporary fit, so that we can set up your denture, because it's not custom made. They just kind of put acrylic over that, and it's not really sucked down onto it. Okay, the wax rim, again, they're bite rims, several layers of wax, and they put that to the base plate. Again, these rims are used to register the space provided by the teeth specific to each patient. So some patients may have a longer wax rim, some patients will have a shorter wax rim, some patients you're going to flare it out, some patients you're going to tip it back. All depends on the anatomy of the patient. And using that custom tray, again, you're going to take your final impression, which what we're trying to get is really good anatomy, and we're trying to mold, you know, all the lip lines and all the vestibule here, all that roll, so that the denture can be as exact as possible. Okay. Again, we're trying to get way back here on the hamular notch back here. You're trying to get the frenums here, here, and here, and a good roll all the way around the palate. If you have any bubbles or anything, sometimes you'll peel that out and retake it, because if you don't get a good impression, you're not going to get a good fitting denture. Dentures are hard enough to do. So please fabricate base plate and wax rim on the master cast. So they'll pour up that impression. Now you've got your master cast. So the other preliminary cast, again, that's not really well defined. They're going to work out of this master cast to make the final denture. Okay, so here's your master cast, your base plate, and there's your wax rim. Okay. That wax rim comes back, the base plate and wax rims are inserted into the patient's mouth. We adjust it so that we support the lip or push back the lip, depending on what we need. Adjust the bite to the height that we need, and we record that. We send that to the lab. So again, here's the bite registration on the wax rim. Completed bite registration after we've shaped that acrylic or the wax. So please fabricate wax trying with teeth, shade A3. Please mount on articulator with opposing cast. So this is what they're doing. Here we have a lower partial, but they're setting the teeth onto that wax rim that you sent back. Okay, so this is what you're going to get back, and this is the critical appointment, because you got to make any changes on this in this appointment before you put process. Sometimes we'll tell the patient, make sure you bring your husband, bring your daughter, somebody to look at them and say, because the patient will look at them and it's like, yeah, they look good. But then they get home and it's like, that doesn't look like you at all. You know, so
why are your teeth longer?
Yeah, exactly, and it'll happen. And they'll come back, oh, my husband didn't like them. Well, guess what? You gotta redo those. Yeah. So sometimes we'll even have them sign and say, yes, I agree to this, and I like the shape, the size, the color, and the position. And then you say, you know, process and return for delivery. Delivery appointment, again, we're going to deliver it, we're going to check the bite, make sure the phalanges and the extensions are good, and usually that first appointment, or that appointment, the patients will say that it feels like they've got something in their mouth, and well, they do, a whole bunch of plastic in your mouth, and they'll, you know, they feel like it's too full, and you do the best you can to make it comfortable, and you just, you know, it's a mind game. Especially patients that are going from natural teeth to a denture, they have to accept mentally that you're not gonna be able to chew, talk, or speak, or taste the same as with your natural teeth, you know. And from appointment one, you have to start training them. You know this is gonna happen. You're not gonna be, with your natural teeth, you go from about 300 pounds per square inch pressure when you chew. You put on a full denture over a full denture, you go down to about 25 pounds per square inch. So can you imagine buying a hamburger or buying a sandwich with your natural teeth, 300 pounds, and now you're going to 25 pounds per square inch. That's what you have to tell them. You've got to cut your foods into small pieces. You've got to chew on both sides. Instead of just, you know, chewing on your right side, you've got to chew on both sides, because if you chew on one side,
It's gonna start.
it's gonna rock. You know, to the side you put food over here, this side's gonna go click, click, click. So they have to learn how to chew with those things. So it's a whole, and from appointment one, you have to start training them. Because once you deliver them, it's a mind game. Most patients will get used to it. Some patients, when they're at home, they take them out, and when they leave, they put them on. It's more of an aesthetic thing, you know. But they'll just keep their top one on. They won't use the bottom one. You know, and dentures are not fun. Some of the most tough patients are denture patients. And then you usually come back, you know, 2 or 3 times for adjustments. I had a patient yesterday who came in, we delivered her denture 3 years ago. Never came back, and yesterday she came back. And so we did an immediate denture where we took out all her teeth and put her denture the same appointment. And then, you know, they fit good, and so she never came back. So yesterday I saw her again, and so the gums over time, they shrink, you know, after the surgery. So now it's wobbling, and she's got a few sore spots, and she's using a lot of that adhesive, and she's wondering why. And it's like, well, you never came back for a reline, you know. So now we're relining her denture. But that's what will happen over time. But usually you'll see them 2 or 3 times just to adjust them, and then hopefully you don't see them. Ideally you want to see them every year, but if it fits good, you won't see those patients till something breaks or they're having a problem. So again, here's the list of the denture appointment. Examination, primary impression. This one here, oral surgery, why is that in there? We're doing a full denture, right? Yeah. Sometimes you'll get patients that have teeth in there, but they're doing full denture. So you take your preliminary impression, you send it to the lab. The lab will just chop those teeth off and give you your custom tray. So then the patient comes back and you take those teeth out and you can use your custom tray. So oral surgery, to make sure you're taking out all the necessary teeth. And then once the surgery is done and they heal, then you do your final impression. Then you got your bite registration. Again, with the wax rim, you set your dimension, and then your support your lip. Set your midline, your smile line. Then you do your wax try-in, make sure the patient likes it, then you deliver it, and then you see them back for adjustments. And that's what you'll get. Again, you can see the definition, and this depends on your final impression. Again, all this, and some patients don't like this. Sometimes the patients, you'll have to cut some of this back because they'll say, you know,
Makes it sore.
Not sore. It's just they just feel like they've got too much in there. But ideally, you want the extension because it helps stability, because it's resting where it needs to be. But it's tough. You know, this patients will say, "Oh, I feel like it's right under my nose." Well, it is right under your nose.
I can just imagine it like being a little sore feeling.
Initially, you're going to get sore spots. That's why you see them 3 or 4 times afterwards, because especially your gums aren't used to having anything rub on them. So it's kind of like going out gardening the first day.
They get like calluses after a while, the gums?
The gum just gets tougher, yeah. Okay, immediate dentures, like I said on this one patient I saw yesterday, sometimes we'll leave the front teeth, because the patients don't want to go without any teeth while you're making their denture. You don't, ideally, you take out all the teeth, let things heal, and then you make the denture. But some patients don't want to go without any front teeth, because they're working, obviously. And so we do what's called an immediate denture, where we take out all the back teeth, and we'll leave, you know, the front 6 teeth, or whatever they have. Okay, and we'll work through the process as far as we can until the day that the denture is delivered. Then they'll come in and we'll take out the remaining teeth and we'll deliver the denture.
Save it for vacation.
What's that?
Save for vacation.
Yeah, and
It's vacation time.
so again, after several months of healing, the denture needs to be relined, which this patient never did until yesterday. So again, if it fits good, you know, patients, you won't see them, which is a good thing, but eventually they'll come in. So I think there's a test question on immediate dentures. I don't know whether there's not a star, but again, immediate dentures is the day that you deliver the denture, you extract teeth. Okay. Again, the reline is just as the tissues shrink over time, the denture will get loose, and a reline is just putting a new base underneath there, adding material to where the bone resorbed or the tissue changed so that it fits a little tighter again. Okay. I don't think a reline is, but I think there's an immediate denture question. Okay. Care instructions for removables: always keep the appliance in a moist environment to prevent warping, and make sure they don't leave it out in the sun in their car, because here in Tucson at 110 degrees in the car, acrylic doesn't like it. Oh yeah, it'll warp, it'll crack it. Or clean it daily with hand soap or a denture cleanser. Okay, try to stay away from toothpaste. They do sell some denture brushes that they can use that are kind of pointy and can get into little areas. It says never soak in bleach. I tell them a teaspoon of bleach every now and then, because sometimes they come pretty nasty. But again, when I do tell them, the reason it says here is because it's going to discolor them. Okay, so I just tell them put a little teaspoon of bleach, just to disinfect them.
Disinfection is usually like 10 minutes, isn't it? It's not long, so.
Again, remove while asleep to allow tissues to recover. Usually, and some patients say, oh, I can't sleep without them. We'll take them out during the day. You know, when we wake up in the morning, take them out, clean them while you're getting ready, and then pop them in. But allow your gum tissues to rest. Again, avoid cleaning them with any abrasive toothpastes. Questions?
No.
Do you have a study guide?
Oh, yeah.
There you go.
That's a good
No,
question.
That is a good question.
I have your phone number, it's just written down. Thank you.
Oh, yeah. Better save it.
I know, I do. I just smiley face next to me. Should put partner.
Partner in crime.
I did.
Alright, should be printed. Sorry about that. Okay, we'll go. This lab is a lot of review of what we just went over, so we'll probably
Just go over it.
go through kind of quick. And then if Dr. Cervantes gets back, I think he's got the